everybody and welcome back. This is Dr. Mridula here. So you must have been wondering, right, why after 40 years you require reading glasses in spite of having a perfect vision till then, or in spite of having no issues like you're not diabetic, you're not hypertensive, you do your exercises regularly, then why do you require reading glasses? Well, let me tell you, it's a natural process. It's called as presbyopia, where it's a natural aging process and it literally happens to almost everyone. Okay, so imagine your lens like a rubber band, an elastic rubber band which has been stretched for long decades. And suddenly what happens is over a period of time, it tends to snap out, right? The rubber band also eventually tends to lose out its elasticity. It tends to become a little weak. So similarly, the lens, the eye muscles, over a period of time, what happens is it kind of loses its elasticity. It becomes a little weak. So it becomes a little difficult for your eyes to actually adjust on the focusing abilities. What happens is, since the lens has become stiffer, less elastic, and even the muscles that control the lens have become weaker, so suddenly when you shift your focus from far to near, so when you have to read something or sew something or look at your phone, it becomes difficult for your eyes to actually adjust that focus. So as a result, the images which are at a very close distance, they tend to become blurry. So you'll have to naturally increase the font size, or you'll have to actually push it a little back to see things very clearly. That is where we start using these reading glasses, because they tend to act more like a magnifying lens. Now they help your eyes to focus on nearby texts or objects. They reduces eye strain and headache and makes nearby tasks a little more comfortable for you. Another question which patients ask me is, doctor, is it permanent or does it keep increasing? Well, so usually it starts with 40, where you generally require a very mild glasses of strength of either +1 diopters, and it gradually increases once you touch 50, and then once you touch 60 it keeps increasing. But after that, once you touch 60, it more or less stabilizes. So the take-home message is, most of us will require reading glasses. So there's nothing wrong in wearing those reading glasses. It's a natural aging process. Point is, if you don't wear, you're just going to cause a lot of strain and unwanted, unnecessary headache to yourself, which is not required. Okay, so think about it. Take care.